Wheelchair billing for DME suppliers, manual, power, groups, and ADP requirements. This is educational content based on publicly available CMS data. It is not legal, medical, or billing advice. Always consult your compliance team for guidance specific to your practice. Wheelchair billing is one of the most complex areas in DME and one of the most profitable when done correctly. Between manual and power wheelchairs, there are dozens of HCPCS codes, multiple group classifications, and strict documentation requirements that determine what you get paid. Getting the code wrong can cost you thousands per claim. This video breaks down every code category, every group, and every documentation requirement you need to know. Section 1. Manual Wheelchair Codes, K0001 through K0009. Manual wheelchairs use the K-code series. The four primary codes are K0001 through K0004. K0001 is the standard manual wheelchair. It's the most commonly billed and lowest reimbursement. K0002 is heavy-duty, designed for patients over 250 pounds. K0003 is lightweight, total weight under 36 pounds. And K0004 is high-strength lightweight, designed for active users who self-propel. The reimbursement difference between these codes is significant. According to the DMEPOS fee schedule, a K0004 pays roughly 2 to 3 times more than a K0001. But the documentation must support the level you bill. For K0003 and K0004, you need clinical justification for why a standard wheelchair is insufficient. The physician's order must specify the type, and the medical record must document the patient's mobility needs, body measurements, and why a lighter or stronger chair is medically necessary. There are also specialty manual wheelchair codes. K0005 is an ultralight wheelchair, the highest reimbursing manual chair. K0006 and K0007 are heavy-duty extra-wide. K0008 and K0009 are custom manual wheelchairs for patients with specific positioning needs. Every manual wheelchair is purchased, not rented. You bill with the INU modifier, new equipment. The full reimbursement comes in one payment. Section 2. Power Wheelchair Groups, Understanding the Classification System. Power wheelchairs use a completely different coding structure. They're organized into groups 1 through 5, with each group representing a different level of capability and reimbursement. Group 1, codes K0813 and K0814, are basic power chairs. Standard power with standard seat. These are the lowest reimbursing power wheelchairs. Group 2, codes K0820 through K0829, are the workhorse of power wheelchair billing. Group 2 includes standard and rehab power chairs. Code K0823, specifically, is the Group 2 power wheelchair without power options. This is the most commonly billed power wheelchair code, and it pays significantly more than Group 1. Group 3, codes K0835 through K0843, are complex rehab power wheelchairs. These are for patients with significant mobility limitations who need specialized seating, tilt, recline, or elevating leg rests. Groups 4 and 5 exist, but are rarely billed. Group 4 adds enhanced programming capabilities, and Group 5 includes pediatric power wheelchairs. The critical point: the group classification is determined by the patient's medical needs, documented through a comprehensive mobility evaluation. You cannot simply choose a higher group for higher reimbursement. The documentation must support it. Section 3. The ADP Requirement, Assistive Technology Professional Evaluation. For all Group 2 and higher power wheelchairs, Medicare requires an evaluation by a Qualified Assistive Technology Professional, or ADP. This is not optional, it's a coverage criterion. The ADP evaluation must include a comprehensive assessment of the patient's mobility needs, a recommendation for the specific type of power wheelchair, justification for why a lesser device won't meet the patient's needs, and specifications for seating and positioning components. The ADP must be credentialed through RESNA, the Rehabilitation Engineering and Assistive Technology Society of North America. Not all therapists are ADPs. The supplier must verify the ADP's credentials before accepting the evaluation. In addition to the ADP evaluation, The patient must have a face-to-face examination by the treating physician. This examination must occur within 45 days before the written order. The physician must document the patient's mobility limitation, explain why a power wheelchair is medically necessary, and confirm that the patient was seen in person. The written order must include the specific group and code, the seating options, the physician's signature, and the date. A generic order for a power wheelchair without specifying the group will be denied. According to CMS claims processing data, the most common reason for power wheelchair claim denials is incomplete or missing ADP evaluation documentation. The second most common is the face-to-face requirement not being met within the 45-day window. Section 4. Accessories, options, and add-on codes. Wheelchair accessories are billed separately using E-codes. Each accessory has its own HCPCS code, and each must be justified in the documentation. Common power wheelchair accessories include E2601, general use seat cushion, E2603, skin protection seat cushion, E2620, positioning back cushion, E1002, seat elevation system, E1029, ventilator tray, and K0108, the power tilt option. For manual wheelchairs, common accessories include E0552, elevated leg rests, E0555, armrests, E2210, positioning belt, and E0967, manual standing frame. Each accessory must be ordered separately by the physician and must have medical justification in the record. Bundling accessories that aren't medically justified is an audit trigger. One important distinction: power options like tilt, recline, and seat elevation are only covered for Group 2 and higher power wheelchairs. You cannot add power options to a Group 1 chair. If the patient needs power options, the chair must be documented as Group 2 or higher. Section 5. Common wheelchair billing mistakes and denial prevention. Wheelchair claims have one of the highest denial rates in DME. Here are the mistakes that cost suppliers the most money. Mistake 1. Billing Group 2 when the ADP evaluation only supports Group 1. The ADP evaluation determines the group, not the supplier, not the physician. If the evaluation documents that a basic power chair meets the patient's needs, you cannot bill Group 2. The OIG specifically targets group upcoding in power wheelchair audits. Mistake 2. Missing the 45-day window for the face-to-face exam. The physician exam must occur within 45 days before the written order date. If the exam was 50 days before the order, the claim is denied. Track this deadline in your system. Mistake 3. Accepting an ADP evaluation from a non-credentialed therapist. The ADP must hold an active RESNA credential. If the therapist is a physical therapist or occupational therapist but not ADP certified, the evaluation doesn't meet Medicare's requirements. Mistake 4. Not documenting why a lesser device is insufficient. For every group level above Group 1, the documentation must explicitly state why a lower-level device won't work. This is called the stepped approach. You must demonstrate that simpler, less expensive options were considered and rejected for documented clinical reasons. Mistake 5. Forgetting to bill accessories separately. Each accessory has its own code and its own documentation requirement. Suppliers sometimes forget to bill for seat cushions, positioning belts, or elevated leg rests that were included in the delivery. That's missed revenue. The wheelchair billing process is documentation heavy, but the reimbursements justify the effort. A properly documented Group 2 power wheelchair with accessories can generate over $5,000 in a single claim. The key is getting the documentation right before submission. If you found this helpful, subscribe to DME Insider for daily tips on billing, compliance, and denial prevention. And if you want to automate wheelchair documentation tracking, group verification, and claim validation, visit MyMedi-AI.com to start your free 7-day trial. No credit card required. Thanks for watching. See you in the next one.